Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and I hope this is very convenient for the continuous study. My dear friends, in the last class, we have been discussing about the newborn care, and we have discussed enough about the delivery room care. And during the delivery also what has to be done, and care of the normal newborn after the delivery. So these points are also explained. Today we will see some of the other explanations related to newborn care. Clothings. Now clothings is also very important. Newborn clothing is also very important. uh, Newborn clothing should be soft, white and clean. In short to say, it should be very soft, it should not have rough, and it should not contain any irritative materials. Some of the synthetic or chemical materials by which the cloth has been made may be proved to be allergic to the newborn skin. So therefore it should be soft enough and cotton, and it has to be washed. The fresh clothes should not be used because because during the process of the dyeing and all, so many chemicals are used, so it may be irritative to the skin of the baby. So once you have to wash it thoroughly and then it has to be used. Soft, white and clean. So this is the principle. Now there should not be any pins, hooks or buttons, only ties. So tie made up of the cloth, that has to be only used, because these pin, hooks and buttons may be proved fatal at times. So we have to take sufficient care. Now clothing should be in such a way that it should be easy to wear and also easy to remove, because newborn passes the urine many times, and we need to change the diaper or clothes many times. So we have to change it also. Now no synthetic napkin should be used, it is not good. And don't put a newly purchased clothing to the baby until and unless it is washed with a Dettol like solution. This is what I explained earlier. Now the important another one is cord care. Now cord care, we have got a lot of revolution in this. Previously we are following different methods. Silver nitrate solution application was done. Now that it is completely shifted to another way, that is left open to dry. So umbilical cord should be dry care. Nowadays we have to go for dry care of the umbilical cord. That means only you have to clean the surface and surrounding by using the spirit, starting from the center to periphery, and you should not touch the umbilical stump. It should be left as it is for healing by drying. So often clean with the spirit twice or thrice daily, and there is no applications required. There is no application of the powder, neosin and some like any other oils. Everything should be avoided because of risk of infection. Only thing is, every day you have to take care of the umbilicus. You should see whether it is inflamed, whether any discharges are there, whether it is detaching properly or not. Okay, so umbilical stump is healthy or not, that you have to see. And meanwhile we have to watch for any bleeding, secretions or oozing, etc. If that is there, or if there is in reddish area is there, so then it may be indicative of umbilical sepsis. And if these umbilical infections, if not cared properly, treated properly, it may lead to umbilical granuloma, which leads to bleeding. So therefore cord care is very important. Only thing is dry care. Take sufficient care. Keep the surrounding areas of the umbilical cord aseptic by washing with the spirit and all, and don't apply anything on the cord. Now talking about the bath, there is little controversy in the bath. However, no bath is required soon after the birth. Soon after the birth, it should be cleaned with the oil or simply cleaning with the hot water dipped in the, that is cloth dipped with the hot water can be used to clean it. Immediately after birth, there is no need of any bath, and it is not quite good also because of risk of hypothermia and all. And Vernus caseosa, which is present there, that should not be forcefully removed because that helps to maintain the temperature. Now during winter season and in cold climatic areas, bath can be postponed definitely for a week ahead. But as far as the tropical areas like India is concerned, It is better to give the bath as there will be excessive sweating and the stickiness will be there, which may predispose to the infections. By keeping this in mind, we can go for a bath after 1 or 2 days. Bath after oil massage is always good. Oil massage, when you're massaging the baby, one thing is baby enjoys the massage. Number two is it's an opportunity to observe for the minor deformities or congenital abnormalities of the baby. And third one is it increases the blood circulation, and also the oil which is applied which also helps to increase the that means helps to maintain the temperature, and massage also increase the heat. So therefore, as a whole, it is helpful to maintain the temperature. In the busy ward or in the crowded hospitals, usually no bath is advised due to the risk of nosocomial infections. But as far as home environment is concerned, definitely bath should be given, especially in tropical areas, followed by the massage. It's not simple bath. First you go for oil massage, and then this will be followed by the bath. At home, safely bathed as for a traditional Indian method over the extended leg. Now, giving the bath to the child and massaging the baby over the extended legs, the traditional Indian method is one considered as one of the best method, and baby enjoys a lot. It also gives opportunity to observe the minor abnormalities, and also it increases the blood circulation, helps to maintain the temperature. Now talking about the vitamins, whether we have to go for any vitamins immediately after the birth, yes, normal full-term babies do not require any vitamin supplements. And nowadays vitamin D3 has been made compulsory almost all to prevent the early onset of nutritional rickets. The reason is we are going for exclusive breastfeeding, and breastfeeding does not contain good amount of the vitamin D3 or vitamin D. And for the 6-month baby will be only given with the breast milk, so definitely baby may have D3 deficiency. But this is okay provided if you are exposing the baby a lot to the sunlight. But the present scenario, it is also very difficult to expose the baby sunlight at least for 30 to 40 minutes per day due to so many variations and limitations, like sunlight may not be available around the clock in all the season, and the nuclear family and many things. So therefore now on the safety measure we are going for vitamin D3 drops for all the babies till 1 year. Talking about the immunizations, baby should be given BCG and first dose of oral polio and first dose of the hepatitis B at the time of the discharge. Now it's a different issue if it is a preterm or less than 2 kg. It has to be postponed to some time. That means either the baby has to be 1 month old or baby should have been attained more than 2 kg. This is the criteria to give any of the vaccines. But as far as the normal babies are concerned, yes, during the time of the discharge, 3 vaccines should be compulsorily given: BCG, oral polio, and as well as hepatitis B 0 dose. Now talking about the sleeping pattern of the newborn, a baby during the first month of the birth usually sleeps for 18 to 20 hours per day and awakes when it is hungry or uncomfortable, like passing of the urine, etc. So ideally you should sleep for 18 to 20 hours, because deep sleep helps in the production of the growth hormone and also the prolactin, etc. That means rather helps to increase the growth hormone secretion, which is very good, and awakes when the hungry or uncomfortable. Yes, now it may awake for a few minutes during and in between the feeds. That's a different issue. Otherwise, usually in the first few months, 1 month especially, baby used to awaken during the night hours most of the time, and during the daytime it is on continuously deep sleep, which is very good in the part of the baby. Talking about the stools, the first stool of the baby is always dark green and black and sticky, and it is also called as meconium, and it will be passed within first 24 hours after the birth. Baby should pass the first stool 24 hours after birth. Most of the babies, they pass the stool immediately after the delivery when you are cleaning the baby. And after initiation of the feeds, the color of the stool slowly changes to the green. Once you start with exclusive breastfeeding, the color of the stool slowly changes to green and greenish yellow, and finally it will be yellow. So in this phase, the stool is called as transitional stool. The normal baby who is breastfed can pass up to 7 to 8 times bright yellow pasty stool, very sticky, or one stool per day at least. Sometimes it passes once in 2 to 3 days. That is also quite common because what you're giving is only fluids, and the solid portion is almost completely absorbed, because biologically it is available. Breast milk is nothing there to be get wasted. So therefore amount of the stool formed itself is less, so that may therefore sometime baby may pass 2 to 3 days, once in 2 to 3 days. Similarly, baby must pass urine within 48 hours after the birth. If the baby is not passing 48 hours after birth also, then we have to investigate for so many things. Similarly, if the baby is not passing the stool for within 24 hours, we have to investigate for incorporate anus and so many other congenital abnormalities. Similarly, if the baby is not passing urine up to 48 hours, then it is again a danger sign, and we have to investigate for that. Most of the time baby pass the urine at the time of the birth itself, delivery itself, which is left unnoticed, and maybe sometime a matter of anxiety for the mother and the parents, or even for the doctors. So most of the time baby passes the urine at the time of during the process of delivery itself. So otherwise it should pass at least 5 to 6 times per day. The adequacy of the breast milk secretion or breastfeeding is also assessed by the number of micturition per day. Okay, number of frequency of micturition per day. If the baby has got 6 to 7 times urine passing, and that indirectly suggests that breastfeeding is also very adequate, and it is sufficient for the baby. Sometimes baby passes the urine at the time of the delivery, as I told earlier, which is left unnoticed. It may lead to anxiety in parents and as well as doctors. Talking about prevention from the infection, baby is prone to infection of many kind, hence unwanted handling should be strictly avoided, and room where the baby should be kept with the mother should be isolated, and it should be restricted for the visitors. Visitors are not encouraged to touch the baby, kiss the baby, touching the baby, holding the baby, okay, because visitors are the great source of infection. And this is a logical issue. You cannot even deny them when they are very close relative, but at least if they are touching, they have to maintain the strict aseptic measures. Premises where the baby has been kept, it should be very neat and clean and hygienic. Clothing of the baby and the mother should be hygienic, and mother should be observed for maintaining the aseptic condition. Now mother should be encouraged to feed the baby. So rightly the breastfeeding advice to the mother should be started from the antenatal period itself, which gives fruitful results immediately after birth. Keep the baby in close contact with the mother. We know that it helps to maintain the temperature, and also it helps to prevent the infection. Educate the mother and to put the baby on her breast repeatedly for the sucking, because when the baby is sucking and mother gets suckled, then only the breast milk secretion begins. So these are all some of the basic things. In the next class we shall see what is explained about the newborn care in Ayurveda. Thank you very much.